What is health insurance exactly? Health insurance is a system that gives members access to health care they would really struggle to afford on their own. After all, none of us really knows when our next illness or chronic condition will set in. If you didn't have insurance and you had to pay out of your own pocket, you could be out a lot of money, even thousands of dollars. Break your arm and need a setting and a cast? That'll be $3,000 or $12,000 if you need surgery. Having a baby? An uncomplicated delivery can run $12,000 to $25,000. Tear a ligament in your knee? Surgery and physical therapy can hit $20,000 very quickly. A serious illness like cancer, a heart attack, a stroke, or kidney failure can easily run into hundreds of thousands of dollars. At its core, having health insurance means that when something challenging happens in your health, you never run out of coverage, because health insurance today has no caps on how much it'll pay, even if it runs into the millions of dollars. By paying a much smaller amount into a common fund each month ahead of time, you can limit the damage from financially devastating effects. So, what do we need for health insurance to work? An insurance company, like Blue Cross, must have members who trust us enough to give us their money, which we manage according to very strict federal laws and use to pay our network of medical providers, doctors, labs, imaging centers, and hospitals. There is nothing random about how we pay medical providers. Every service imaginable a member could use is negotiated in advance. And you can see the discounted price you get just for being a Blue Cross member in your discounts column on your explanation of benefits. Since we cover the cost of health care directly for so many people, we need to be really good at predicting how much care they will use. We have actuaries, people with advanced degrees in mathematics, who are really good at predicting how much health care our members will need in the future. They are the ones who tell us how much to charge you based on how much they think it will cost to take care of everyone in our risk pool. The individual risk pool just doesn't look enough like Louisiana. It should be as large and diverse as possible to keep costs low. The result? Rates have doubled since 2013, and we've lost more than $200 million trying to keep this group of people healthy. Without diversity, everything gets much more expensive. Did you ever wonder why some things are covered in your health insurance policy and some things aren't? Well, first, federal law tells us exactly what needs to be covered because of the Affordable Care Act that was passed in March of 2010. State law also tells us what needs to be added to your policy. And then we look at science and economics to determine what things we can cover will make the health plan stronger and make sense financially. It's also worth remembering that every year you're paying between 3% and 4% of your premiums just to support the taxes added at the federal level since 2010. So, what are you supposed to do? While you can control some of the things behind your premiums, there are some steps you can take to try to keep your out-of-pocket healthcare costs low. First, stay in your network. You will always pay less for your healthcare when you're seeing a medical provider who is in the network for your health plan, thanks to those discounts we talked about earlier. Second, pick a PCP. A strong relationship with a primary care physician is critical if you want to stay healthy over your lifetime. Now, that could include a general practitioner, an internist, a family medicine doctor, a geriatrician, or even a pediatrician for children. Going to your doctor's office is much less expensive than going to the emergency room, to urgent care, or to a hospital for routine care. And finally, sign up for your Blue Cross member account at www.bcbsla.com/activate. You can go online or through our BCBSLA app to keep on top of your claims, to see who's in your network, and to learn more about the benefits and the services covered on your health plan. And that's the Straight Talk on health insurance.